The California Endowment is a private, statewide health foundation that has played a pivotal role in improving the health and wellness of underserved communities across California. Established in 1996 as part of the conversion of Blue Cross of California from a nonprofit to a for-profit corporation, the endowment has since evolved into one of the most influential philanthropic organizations in the state, with a strong emphasis on addressing the root causes of health inequities. Founding and mission. The California Endowment was founded with a mission to expand access to affordable, quality health care for underserved individuals and communities, and to promote fundamental improvements in the health status of all Californians. Its guiding principle is that health does not begin in a doctor's office, but in homes, schools, jobs, and neighborhoods. The foundation emphasizes a holistic view of health, focusing on the social determinants that influence well-being such as education, housing, environmental safety, and community empowerment. Strategic focus and initiatives. One of the hallmark features of the California Endowment is its commitment to long-term systemic change. Rather than simply funding short-term health interventions, the foundation targets policies and structures that shape health outcomes. Its work spans across various priority areas, including 1. Health equity and racial justice. The endowment acknowledges that health disparities are often rooted in historical and systemic racism. Therefore, a key component of its strategy involves addressing inequities in policies, institutional practices, and community conditions that disproportionately impact communities of color. The foundation supports grassroots organizations and coalitions advocating for racial justice and health equity. 2. Building healthy communities, BHC. One of the endowment's most ambitious initiatives is Building Healthy Communities, a 10-year, billion-dollar plan launched in 2010. The initiative focused on 14 communities across California with high levels of health inequities. The goal was to transform these areas by empowering residents, supporting local leadership, and improving systems that affect health such as education, justice, housing, and employment. BHC sought to make real, measurable improvements in outcomes like reduced youth incarceration, improved school discipline practices, greater access to health services, and community safety. It emphasized youth engagement, civic participation, and grassroots activism as levers for sustainable change. 3. Youth advocacy and empowerment. Recognizing young people as critical agents of change, the California Endowment invests significantly in youth leadership development. Programs like the Youth Awards and support for youth-led media projects help amplify the voices of young Californians, especially those from marginalized backgrounds. The endowment has funded campaigns where youth advocate for health justice, education equity, and safe, inclusive communities. 4. Health for All campaign. Another impactful effort by the endowment was its support for the Health for All campaign, which advocated for expanding health coverage to all Californians, regardless of immigration status. This campaign played a role in influencing state policy decisions, such as expanding Medi-Cal to undocumented children and young adults. Philanthropic approach. The California Endowment stands out for its community-centered, participatory approach to philanthropy. Rather than dictating solutions, the endowment often collaborates with community-based organizations and residents to identify priorities and implement strategies. It places a strong emphasis on equity, inclusion, and community voice, particularly from historically marginalized populations. Moreover, the endowment does not merely focus on funding programs, it also actively engages in policy advocacy, research, and public education. It uses data and storytelling to highlight systemic issues and influence public policy and perception around health and equity. Governance and leadership. The foundation is governed by a board of directors and led by a president and CEO. Leadership has included notable public health advocates and community leaders who bring experience in both policy and practice. Under their guidance, the endowment continues to evolve its strategies to respond to emerging challenges such as climate change, the mental health crisis, and structural racism. Impact and legacy. Over the years, the California Endowment has invested billions of dollars in communities across the state. Its legacy is visible in numerous policy reforms, stronger community organizations, youth-led movements, and healthier, more equitable neighborhoods. The foundation has also helped catalyze broader philanthropic shifts towards systems thinking and equity-based grant-making. Looking ahead, as California faces new and persistent health challenges ranging from climate-related disasters and homelessness to mental health crises and healthcare affordability, the California Endowment remains a key stakeholder in crafting equitable, community-driven solutions. Its continued commitment to amplifying marginalized voices and transforming systems ensures that it will remain a powerful force in California's public health landscape for years to come. In essence, the California Endowment exemplifies a modern, progressive approach to philanthropy that prioritizes justice, equity, and the well-being of all people, particularly those who have historically been left behind.